Okay.
Yes, we are good to go.
Okay. Yes, so welcome everyone once again. Thank you for taking time to join us today on this mental health awareness check webinar, whatever you want to call it. The main reason why myself, Dr. Maryam, and Kauthar put together this webinar is mostly because as a parent with a child on the autism spectrum, we know how overwhelming, how stressful, how tiring it can be, and how much we can actually forget or lose ourselves in the pursuit of, what to do for our children, or how to take care of our children, and how to develop them, working with them. I know firsthand these experiences are kind of difficult, and when you lose yourself in those things in the world where we are, with so many things going around us, it's important that we call ourselves or remind ourselves to check our mental state of health. I was listening to a workshop the other day, where my mentor, because I am also an NLP coach, and my mentor was talking about how can you take care of other people if you can take care of yourself first. So we all have to remind ourselves how to prioritize ourselves, self-care, mental checks, check that we are doing okay, regardless of whatever we are going through. And I thought that who can be in the best position to tell us more about what we need to do to care for ourselves, or how we need to do to check our mental state, because believe me, if we don't have the right mental state, we cannot achieve anything with our children. And this is really one of the things that motivated me and the rest of my team to put this together, and hopefully it will be beneficial to every one of us as we prepare for what is to come in this coming year. We have to really prepare mentally what is to come. We don't know what is coming. It could be good, it could be better, it could be worse. Anything can happen with our children, with the challenging behaviors and everything. So without furthermore talk on this, like I said, there is no better person to give us this session than Dr. Maryam. Dr. Maryam and Aliyu. Yes, I've tried to mix up the names with Kauthar, and she is a medical doctor. She has MSc in psychology, a PhD, diploma in clinical psychology, an MSc holder, and a diploma in mental health. Sorry, I'm a little bit rusty with your introduction, Dr. Maryam. Apologies about that. She's also a parent with a child on the spectrum, on the autism spectrum. And honestly, Dr. Maryam has been with me, I think from the beginning of this year. She's one of those parents that she's always showing up, regardless of what comes, always showing up for her son, trying to get the best out of him. And I applaud her. She's always prompt. She is a woman of her words. And I believe there's no one better to be able to carry us on this session other than her. So I will hand over to Dr. Maryam to start with the session. So we have 2 sessions going on. It's going to be really brief because I wouldn't want us to take a lot of our time. It's late, a lot of us have to go to bed. So the first session will be Dr. Maryam addressing parents and, talking directly to us parents and what to do. And the second session will be with Kauthar, which she is also a mental health expert. I will be introducing her right after Dr. Maryam. She will be taking the session about, empowering us with knowledge on how to get the positiveness in our children during this and prepare ourselves for the coming year. So I'll hand over to you, Dr. Maryam. Please take the floor and start with your presentation. You have to unmute. I think you are still muted.
Yes, I'm aware. So can you all see my screen?
Yes, we can.
Yes, we can.
All right, thank you.
We have men on this.
So the topic is unwind, special needs moms and their special needs. So my name is Dr. Maryam Nasser. I'm a medical practitioner based in Kano. And as Sister Fati rightly introduced, I have a son I have a foster child who is on the autism spectrum with some attention deficit and hyperactivity disorder. So I'm also a mental health expert. I have some training, especially in child development and child disabilities. So I hope we exchange ideas and our experiences, and I hope it will be beneficial to all of us here. So I don't know why my screen is not moving. Okay. So the first thing that that usually strikes me when discussing mental health of parents with special needs is the loneliness attached to it. It's very real. So because most of the parents are kind of hiding, should I say, hiding the situation of the child. Sorry, my video is off. I just realized. Can you see me?
Yes, we can see you now. Yes.
Yeah.
Thank you.
Okay. Yes. So in most cases, the parents tend to hide the condition of the child and hide the child himself or herself. So they tend to become isolated themselves. So it's kind of like further complicating the issue. You have a child, maybe he's on the autism spectrum, or maybe he has one of the PDDs, pervasive developmental disorders. So it's there are conditions in which there are social problems with social interactions, problems with communication, and you are further isolating the child because you are sort of ashamed of that child. So it's further compounding the issue. So there is a lot of loneliness attached to being a special needs parent, especially, well, things are improving now because there's awareness, there's more awareness, and people like Sister Fati are doing their utmost to see that parents and the society understands these special needs children. So being a parent in general, being a parent is difficult. We all know that. Most of us are mothers here or caregivers. So we know how parenting is on its own. But then being a parent to a child with special needs, it's a very responsible task. You have to be there. You have to be there all the time, and it's a full-time job. So parents need, in most cases, like I said, parents tend to feel ashamed of these children, sometimes even alienating the children, neglecting them, isolating them, and all that, which I said further complicates the issue. So for parents, they need to understand that these are children that are differently abled. Like, stop seeing them from the point of being disabled children and start looking at them as being differently abled. So parents need to accept these differences in their children and allow them to live their own kind of normal. Their normal may not be necessarily the same as the other children in the household or other children in the family or in the community. So allow them to live their own kind of normal. So who are these, when we say special needs, who are these children that have these special needs or they require special needs? Special needs children or individuals are individuals who require assistance for disabilities, which may be medical, which may be mental, or maybe psychological. They vary in that it can be from physical ailments to learning disabilities or terminal illnesses. Such common examples that we know are hearing impairment, for example, or visual impairment, or mental challenges and conditions like autism, ADHD, cerebral palsy, and so on. So usually these children require special needs in that they need further assistance in terms of maybe self-care or occupational therapy or some other or any form of assistance, or in some cases they even need medical attention that will be given to them to improve their quality of life, so that these children live their lives as normal for them as possible. By normal, I mean normal for them, not normal in the societal context. So normal for them, and so that they can lead their normal lives and improve on their skills and learning. So, but usually you see these things that you are doing something extra. Like I said, parenting on its own, it's a challenge already. So because now you have a special needs child and you are doing something extra, these things can take a toll. They can take a financial toll. There's a lot of financial burden to this special needs. And then physical, psychological, emotional, and social toll. A lot of issues can arise from taking care of a special needs child. So a diagnosis of a child whose brain works differently can make parents feel isolated in a room full of fellow parents, because usually, our special needs children don't behave the way the society expects children to behave. So because of that, usually parents tend to feel isolated, because when we are talking about, okay, let's say we are in a room of parents, let's say 3 to 5 parents are discussing their children, and one of them is talking about the milestones that her child has reached. For example, my child can sit at 7 months, for example, let's say. So my child can sit at 7 months, when someone else knows she has a child with cerebral palsy, and it may take him a year or two for him to be able to sit down when this other child is sitting at 7 months. So these are things that tend to make parents feel isolated, even in a room full of parents. So even the term special needs, it's kind of like a segregation. It's isolating the parents. Even that term, special needs, it means there's something different about the parents and their children. So the term special needs also sets the parents and their children apart. So by special needs, inclusion is the key, and it doesn't mean ignoring the disabilities or differences. Sometimes there is need for the children to be assimilated into a normal school environment, or into a normal environment where they get to interact with other kids, so that they can improve on their own abilities, and sometimes even discover their own abilities. Sometimes they have abilities that we don't know as the parents. So sometimes you need to expose them to certain things, embrace their differences, don't ignore their disabilities, and then you find what that child is able in a different way. Because most of these special needs children, like up to research has shown that up to 50% of them, 40 to 50% of them are called, they have a condition known as savant syndrome. I'm sure most of us here know Elon Musk. Elon Musk is a person, he's also on the autism spectrum, but we also know that he's a genius. So because he has savant syndrome, there's part of his brain that is more advanced than normal. So sometimes these special needs children have their own issues that make them special needs children. At the same time, they also excel in one domain or the other. So embracing the differences and not ignoring the disabilities or the different abilities is actually very key to dealing with special needs children. So yes, understanding and accepting that your kid is different is also a foundation in terms of mental health care for the parent or the caregiver of special needs children. Like I said earlier, being a parent is hard already, and then being a parent to a child with extra needs is extra hard. So, and also it's okay for you to need help once in a while. We all need help once in a while, and it's okay for you to know that, okay, at this point, I need help.
I think she's back.
Sorry, my network went up a bit. At what point did we lose each other?
Yes. You were just at the point where you were talking about the need, when you need help, to ask for help. You just started that slide. Yes.
Okay. All right. Thank you. Okay. Yes. So this is where we are, right? So yes, as I was saying, that it's okay for parents in general to need help, and being a parent to a special need child is extra hard, and it's okay for you to need help once in a while. It's okay for you to know that, okay, at this point I need help, and I'm not embarrassed about it. I know that I need help, and I will reach the right person that can give me that help. So these are some affirmations that I feel will help for a special needs mom or a special needs caregiver to know that he or she is not alone, and it's okay to deserve to be cared for. And the condition, the situation, you yourself as a parent, you are not perfect, and that is okay. And then you won't always get things right, and that's also okay. As long as you are doing something, that's okay. And you should learn to forgive yourself. One thing that I did not put here is never, ever blame yourself for your child's condition. I cannot stress this enough. Some of these conditions come with a genetic component, and some parents tend to blame themselves for the condition of the child. So actually, I strongly advise, I strongly tell parents that it's not your fault. This is your destiny, and you must learn to forgive yourself and never ever blame yourself for your child's condition. And parenting a child with special needs is like a marathon, so you need to pace yourself, because everybody in that household and in the society needs you, not just your special needs child, but the rest of the society, you know, your other children, your spouses, and everyone else needs you. So it's you must find ways to pace yourself and take care of your own needs. So I decided to put up some slides about mental health so as we get into the meat of the discussion today. Parents of special needs children have an increased level of stress, this research has shown, and that studies have revealed that psychiatric disorders are more prevalent in such parents. One of the common conditions in parents with PDD children, that's pervasive developmental disorders such as autism. Depression is one of the common conditions attached to it. And then I mentioned this earlier, intellectual disabilities, ADHD, PDD have a substantial genetic component. And so with this, parents tend to, as a caregiver, as a medical expert is given, you know, is making them aware of the condition, explaining to them that, okay, these are the reason why your child has this disorder or disability. There's genetic component, there may be environmental factors and some other things. Parents tend to blame themselves. So it's like kind of like a catch-22. You are trying to make the parent understand the situation. At the same time, you are trying to make it in such a way that the parent doesn't blame himself or herself. Also, research has shown that a lifetime prevalence of major mood disorders such as depression is higher in parents of children with autism. And that one interesting thing is that the onset of that mood disorder in the majority of these parents occurs prior to the birth of the child. So if you have parents that have major mood disorders just before, as in around the time when you look retrospectively, these children, a high percentage of such parents tend to give birth to children with autism. Not that they are related, but it's kind of like a marker, because these are the conditions for autism, for example, is a condition that occurs even in utero before birth. So it's kind of like a marker that, okay, this is what is happening. And family history, there's strong family history, and studies on family history on autism have consistently shown that a higher percentage of mood disorders occur among family members. So you see, all these things are related, are interrelated, both the physical domain, the genetic domain, and the environmental domain. So the majority of the burden of care is typically carried by mothers, and somehow by the society we are in, this burden is actually expected for mothers to carry, to bear that burden without complaining, without why should she complain, she's a mother, you know, all those things, kind of forcing it on her, not understanding that she is carrying a burden, an extra burden at that. So she may require more assistance than normal. And then she's expected to, just because she's a mother, she's expected to do it wholeheartedly and without complaint. Why would she even be depressed because she's caring for a child? No, these things are okay. It's okay for mothers to go through depression or mood disorders or any type of mental health disorders as a result of motherhood. It's actually very okay. And you know, women are more predisposed to these mental health issues because of our hormonal imbalances. Even without giving birth, without pregnancy, we have a lot of hormonal issues that lead to mood disorders. For example, PMS, premenstrual syndrome. We all know that some women go through a lot of emotional liability and emotional issues around that time. So talk less of pregnancy and then childbirth, you know, child caring. So a lot of things, women are actually predisposed to these mental health conditions. And so it's okay. So by the virtue of her being a woman, she's already at risk. And then by the virtue of being a mother, she's at risk. And then now she's a mother to a special needs child. So she has definitely a much higher risk and she needs all the support she can get. So it has been established that psychological outcomes for mothers are better when there is a more active social life and a family support. The presence of family support, especially that of the spouse, is considered a major influential factor for the mental health of the parents. And greater marital quality has predicted lower parenting stress. A lot of studies have shown that when the marital quality is very good, is a predictor that the parenting stress will be less, because both parents are supporting each other. Maybe other members of the family are supporting them and giving them all the necessary assistance. So I also put up this slide kind of like to re-emphasize our topic of discussion, that parenting is a marathon and it will go on for the foreseeable future. What all of us that are moms of children with special needs know that they don't just heal at the drop of a hat. Let me use that term. It's something that takes time, maybe forever. So the only thing is that you must learn in this situation, you understand that it's a journey. It's a marathon that will go on and on and on and on. But your point is you are not there to win. That it's not a race. You are not there to win. You just want to make it to the end. So in all this, you must remember to give yourself some me time, some you time to take care of you and your needs, no matter how brief. Because if you are taking care of a special needs child and you're not taking care of yourself, you are going to start needing the special attention that your child needs as well. And then in that case, you cannot help the child. So for example, let's say you have a child on the autism spectrum. I'm going to talk about the autism spectrum more because that's what my son is on. So for example, you have a child with autism spectrum and you are constantly taking care of him, doing this, doing that. You have forgotten about yourself and your other children. Now you are depressed. So if you are depressed now, you also have special needs now. And then in that case, your depression will not allow you to take care of yourself, your other children, and your special needs child. So it's very important for you to always remember to pace yourself and take time for yourself. It's not a do or die affair, and it's not something that will go away all of a sudden. So it's going to be there for a long time. So you need time, you need coping mechanisms and time to be taken care of yourself. And also it's very important for you to know that as a parent, to know that you need to celebrate the little wins. Like I was mentioning the scenario about a child being able to sit at 7 months and compared to a child who is sitting now at 2 years. So for that mother of the child that started sitting at 2 years, it's a milestone. It's a huge milestone for her because at least the child now is sitting. So it's okay to learn to celebrate the little wins. Don't expect that, okay, because my child is not doing things at the rate or at the time that his mates are doing. So I'm not going to celebrate what little things he or she is achieving. So it's very good for parents to learn to celebrate the little wins. And one thing that you should never ever compare children, whether they are normal children or they are on the spectrum or they are neurodivergent or they have special needs, never ever compare their abilities. Even among normal children, we do not compare abilities because we are all differently abled. We all have different capacities. And it's very wrong for parents to compare, like say, okay, my first child started sitting at 4 months. So I expect, why is this child at 7 months not sitting? He's not doing like his brother. No, don't do that to yourself, and definitely do not do that to the child. And also do not let parents of normal kids bring you down. I say normal in quotes. So do not let other parents bring you down. Know that, okay, my child has this, always embrace the condition of the child. I'm okay with my child has this, is on the autism spectrum, and I know that his learning abilities is on a different pace as compared to my other children and as compared to other children in the community. So I'm not going to allow anybody to bring me down. If my child says the word, for example, I've been teaching him to say the word food for the past, let's say 5 to 6 months. And the first day he said it, I was very happy. You know, he's 9 years old, and for him to say food, he remembered that I've been teaching him, I won't give him the food until he says the word. So he comes to me And there was a day that I forgot to ask him. And then he came to me and stood by the food and said food. So I was very happy, you know, with those type of situations. So learn to celebrate the little wins, and then make time for you, make time for your marriage and your other kids and your friends and your normal routine activities, and always trust your instincts. You know, okay, this is my child. I'm the best person that knows my child, and this is what my instinct is telling me. This is the type of care I should give him. This is who I should seek for advice. You know, always trust your instinct. So these are some of the things that parents can do to give their mental health a mental check. Now, while you are taking care of these special needs children, are you getting enough sleep? Are you exercising enough? Are you eating proper balanced diet? Are you engaging in relaxing activities? Are you giving yourself me time that I mentioned earlier? Do you have a social support network? These are all things that you can assess within you to find out if your mental health is in check. So if you find that any of these things, the list is actually not exhaustive, so there are many other things, but these are the main issues. So if you find that any of this is wanting, so you need to up your exercise. Exercise releases endorphins and they will improve your mood. Getting adequate sleep is medically very, very important. Proper nutrition, we all know how important it is to have a balanced diet. And getting involved in relaxing activities, it depends on your type of personality and what you enjoy. I, for example, enjoy meditation, a silent meditation. I enjoy art, or maybe listening to music, you know, or, you know, it depends on the person. Some reading, I also enjoy reading, non-academic type of reading. That's why I put it in bracket, because when you are reading some academic stuff, actually your mental health, you just feel some chaos about to happen. And then it's also very important for you to socialize with your tribe. Your tribe, meaning people that you enjoy, people you have things in common with, you know, people who have people you find you enjoy being together with, people how you explain situations to them and they understand, you know, people that get you. So those are your tribe. So it's very important for you to find time. Don't feel that because I'm constantly taking care of my child, you know, I don't know where to drop my child. I don't know where to keep him or her. So I will be isolated from my social life. No, it's actually very wrong. And it's very important for you to re-socialize and remember who you are as a person without the special needs child. Because as I mentioned earlier, if your mental health is challenged, you cannot be of help to that child and to other members of the family. So also self-care routines such as hair care, manicure, pedicure, you know, these are things that we find enjoyable. And some of us actually find joy in shopping and going to the market, you know, pricing things, haggling over things. So these are all things, it depends on you, what you find you're most comfortable with. And most importantly, you need a social support network. Like this one that Sister Fatty brought us here together, Journey with Fatty. So it's actually one of the support networks, because that is where you interact with women who are in a similar situation as you. And then one thing that I keep telling my mom is that when I interact with people that with children on the autism spectrum, you know, such type of social networks, I realized that it helps me understand my own child better. And then I realized that actually his condition is actually very mild as compared to others. You know, I see some of the challenges that other mothers are going through, and I realized, okay, alhamdulillah, I don't have such problems. I don't have such challenges. So it's actually very good for you to have a support system. And then your parents, family, so it's very important for them to support you and your child. And I think this is the end of the slide. Thank you. I don't know when we are going to interact, but I'll leave it to Sister Fatty. Thank you for listening. And if you have questions, I think you can note.
Thank you. It was beautiful. I was smiling halfway through. I was like, you know, yes. You were saying so many things that I could relate to, you know, from the isolation. You know, sometimes in the group, my son's school, they have a Bible group. And then they're asking so many questions about homeworks and so many things. And honestly, I feel it because I cannot relate, because we're not on that level.
Yes.
We are not on that same level with them, you know. It makes me sometimes I don't even go to that group in a week. I don't open it until maybe when I see that there's like a general announcement that concerns me and my son. So I can actually relate to a lot of those things. And, you know, when you were talking about, you know, going shopping, I said, yes, me, I like to go shopping, but there's no money. But when there's no money, what can we do?
Yes.
Thank you so much. It was really full. In fact, I was putting down the takeaways at the points. I can't even finish listing out so many things to take away from this session. Thank you so much. It was really I just want to ask, you know, one question that kind of, you know, sometimes, even though, you know, we know that these things happen, we have to take care of ourselves, but sometimes you find yourself in a situation whereby, you know, you're alone and the kids are driving you nuts, and, you know, your child is having a meltdown, and at that same period, you're also having your own kind of meltdown. You know, how do we deal with such situations? Whereby I had a situation last week whereby I was going through my own kind of I don't know, like a burnout. Yes. And he was having his own meltdown at the same time. How do we balance each other in this aspect?
Yes, so like I mentioned, you know, I said social support, family support is actually very, very important. You cannot do it alone. So at that point, it is very important for the other parents, the father, to intervene, and maybe other families. And I understand your situation. You are in a different country, so the support, the social support, the family support may not be quite a challenge there. So, but other siblings, you know, other siblings in the household, you know, the parents, the other parent can actually assist you. But for you, actually, it's going to be a bit of a challenge because you are in a different country, away from all the support that you need. So actually, it's time for the dad now to buckle up, and other members of the family that are with you, yes, to render their assistance. Because once you melt down, then you are not going to help anybody in that house.
Exactly.
So yes, it's actually very important. As soon as you feel that you are going off, you know, it's actually important for you to call the attention of the household that, okay, this is what I'm going through and I need time away, even if it's just a few minutes or some few hours. Yeah. I need to be away from this. So, and it's okay for you to admit that, okay, this time you need your own time. You are going through something, and it is important that you go through that thing. And it's okay for them to help, to understand and help, and not be judgmental and not blame, or, you know, or try not to understand. No, they should understand that, okay, that you have been doing this for quite a while now, and you yourself have admitted that, as a mother, you have admitted that, okay, I am going through something and I need some time to face myself. So it's actually very okay for you to admit.
Oh, thank you so much. Thank you so much. That was elaborate enough. I believe, yes, that answers quite the questions. And thank you once again. Thank you for this really interesting session. I believe every one of us learned something. We reminded ourselves about something. It's not just about learning, you know, reminding ourselves, creating that awareness in our mind, and telling ourselves that, you know, you should not do this alone. It's okay to ask for help, you know, make time for you, you know, always trust your instincts, and, you know, socialize with your tribe. It's really important. And, you know, when Dr. Maryam talked about you, whenever she connects with a parent with a child with special needs, I also connect so well. I feel so good when I have conversations with another parent. You know, it's just like, or feel that reassertion, or telling myself that, oh, look, after all, I'm not alone. So many other parents are doing this, and they're dealing with it really well. So I can also do this. So it's like a challenge to yourself that if this person is doing this, I can also do that. Thank you so much once again. Now I would like to bring in my friend, my gold partner, and my she's my sister. She's so many things. I'm sure a lot of you are familiar with her because we have a lot of we work together in a lot of aspects. And so I'm bringing on Kauthar Busari. She is an educator. She is an advocate for children with special needs. She is an expert in mental health. She is an expert in children with special needs and other learning disabilities. She is a full package on her own. And I thought she will be in the best position to tell us a little bit about, how, we are farming positiveness in our children. And so, Kauthar, let's have you come on and tell us what you have for us today.
Oh, good afternoon, everyone. Oh, sorry. Good afternoon from my hand and good evening over there.
Yes, good evening. Good
evening.
I don't know.
I'm actually in my video. I think we just have to go on. I don't know. So, okay. Thank you very much, Dr. Maryam. You did a wonderful job. It was really, really fantastic. As in, I was just like, listen, yes, this is it. Yes, this is it. And I believe every one of us have really learned one or two things from what Dr. Maryam said. But I am Kauthar Busari. I'm an educator. I'm going to speak from the aspects of being a teacher. I'm sorry, my camera is not coming on. I don't know why. So being an educator, we interact with these children on daily basis. And sometimes you find out that some children lives in like a denial themselves, or they lives in like a world where they are not sure of themselves. Like they don't really know who they are. Some children talk to you like, I'm not really sure, I don't know, but how do we make sure these children really understands who they are and how they want to be in future or what they want to be? It boils down to the parent, it boils down to the caregiver, and it boils down to the educator. We growing up, there are these beliefs that we have in us that the environment where we lived or the school we attended make us believe that we can't do this or you can't do certain things. And these are subconscious that have been absorbed in the brain. Even as an adult, when you still struggle, because of this observant mind that had absorbed it over years, telling you can't do it, you still struggle as an adult to be able to come out of that shell that I can do it, I can make it, and let go of those thoughts we are having. But because of how long that thought has been ourselves, so what do is like, we do have a self-talk. And this self-talk is, how do we identify this is myself or this is me? And what do we need to do once we identify? The first thing is, how do we identify the self-talk? The self-talk is, what do I have in me? What are those negative thoughts that prompt me? And once this negative thought comes up, it makes me feel unbalanced. You might wake up a day and you're feeling excited, you're okay, you're lively. A thought might just cross you and make the day messy for you. So once that thought comes in place, how do you grab hold of that thought that won't destabilize you or make your day go wrong? So we need to redefine the thought. We need to reaffirm that thought. And these are thoughts that makes positivity come up. So when we have this positivity thought comes up, it makes our day brighten. So now I'm talking to, as a parent, let me talk to parent now. All these things I've been mentioning are for parents. Now you're dealing with a child with special needs. If you as a parent, like Dr. Maryam earlier said, if you don't have the right mindset, if you are not in your right atmosphere, how do you want to deal with a child that is already going through a meltdown? How do you want to deal with a child that is not even sure how it's going to be happening today? So as a parent, it's a whole lot on us. It's a whole lot on our shoulder and our bag we carry. So if we are in the right mental state or in the right mental health position, it makes things easier for us. So as she said, we need to look for those things that makes us happy. Things you like to do that gives you this positive thought, like to go for shopping. Some people it's pedicure. For me, I like pedicure. it makes me feel relaxed, or swimming. Those things, what are those things that we do that we enjoy? Because when you take care of yourself, when you're in your right mindset, everyone around you will be fine. They have that positivity. But if you're not on the right mindset, even when things are going a little bit, you're like, no, everything is just rubbish. So for the kids, how do we tend to help them out to reassure, to reaffirm themselves? One thing I tell kids, they tell you, no, I can't do it. So I used to tell them, you can do it. That is one reassurance. When I talk to parents who have special needs, I said, your eye contact is very vital in your child's life. When you're dealing with your child, give that child eye contact. Your eye contact says a lot. Your eye contact alone tells that child, I'm here. I can listen. I love you. I understand the plight you're going through. But when you're just talking and the child is just like, what's happening? He doesn't understand what is happening. But first thing is, give your child this eye contact and your words as well. Your words goes a long way in their life, in their daily dealings. What you tell them when they wake up in the morning really matters. When you tell a child, you can do it. Like some days they want to go to school and they are telling you, no, I don't want to go to school. Why don't you want to go to school? I don't want to go to school. You have to prompt them to know the reason why. Sometimes you as a parent need to put out the question to them yourselves. You have to start guessing. Okay, is it teacher A or is it Miss A? What happened to Miss B? Okay, is it the shoes you're wearing? Because sometimes you can't even define why they're telling you they're not going to school. So you just have to beat around the bush until you identify a particular thing we could deal or hold hands on, and we work towards that. And you reassure the child that the school is going to be fine today. You're going to do excellently well in class. Your teacher is. And I promise you, when you give them those words and you pick them up from school, the feedback you're going to get, you'll be like, wow, really? So it's something I've tried and I see it work. So I employ us as parents to please work with those words for them. First, your eye contact. Second, your words of affirmation. Third, your consistency. Sometimes as a parent, we start a routine and after some times we relax. And once we relax, there's a bridge. And when there's a bridge, the children don't want to go back to the routine. So as much as possible, the way we are tired or we're exhausted, we should still make our routine consistent. Even if it takes, let's say, usually we use 10 minutes, we use 10 minutes. You could cut it down to 5 minutes if you're tired, or 3 minutes, because the kids are going to know that you still take care of this routine. This routine we do have still take place. It's not like mommy totally canceled it. So these are what we do we do consistency and we do a follow-up and reassurance as well. Also, I have what we call the children to be optimistic. Our words of affirmation and consistency give these children this thought of, okay, you can make it. You make them to be optimistic about themselves. You make them have a self-awareness. You make them have a self-value, a self-thought that they can do things. And we also tell them when they are having these negative thoughts, because as adults, sometimes we do have negative thoughts. So also the children also have negative thoughts. So we need to go around with them. We need to make them understand that it's fine to have these thoughts, but don't let these thoughts overweigh you, because once the thoughts overweighs them, they become pessimistic. And it's not always good to be pessimistic. So we teach them how to be optimistic. The negative thoughts should not overshadow our positive thoughts. So these are things we need to train, because they are kids. The way I'm saying it now is we can't teach them. They don't understand all this grammar. So we have to show them with our word, with our actions, that this is how you go about this. And later they will understand at the final end, oh, when they grow up, they understand, okay, this is what mommy was trying to teach me. But at this period, we need to teach them these things with our behavior, our gesture, our words, our assertiveness. Sometimes they want to go the other way around. You have to be firm. You have to be firm to get some things done the way you want it. So these are things we need to do to get our kids right on track. And I do say, once we are mirror, the kids are mirroring us. So whatever you want your child to do, make sure you do it yourself. If you say, oh, we have a word of affirmation, the word for today is to be kind, or I'm beautiful. Did you say that word to your child, or did you say that word to yourself? I'm beautiful. You know, what you don't say to yourself, or what you don't do to yourself, we don't expect your child to say nor do it. We could only force them, but once you force them, it's not really showing the real self. Yeah, so it has to be something they see in us that we do. And what we do, these children pick it up subconsciously. So we have to watch our actions. We have to watch our utterances. We have to watch the way we relate and deal with things. So I believe with the things Dr. Maryam have said and the few points I just dropped now, our children can get them. And also at this time of the year is a place where children are like, oh, I want to go through my the goals I set for myself this year. And sometimes we tend to beat ourselves. I'm like, come on, we don't need to beat ourselves. You know, when it was December 1st, I had my kids, what were the goals? What were you able to achieve? Oh no, yeah. Okay, I said, okay, that's fine. If you're able to achieve 1 out of 5, you did a good job. It's better than not.
One step at a time.
Yeah, it's 1 step at a time. So we shouldn't overflog ourselves. I tell people, if you're struggling with your child and the child is able to achieve, like, in Montessori, we call it practical life, things that they can do on a daily basis. You can shower, you can brush, you can put on his shoes, he can lay his bed. What else do you want from that child? You shouldn't over push them. Even if they've not achieved all this, but they could identify themselves, they could take up their bag and say, I'm going to school. These are worth celebrating. So for everything, every step, there's gratitude and there's reward. For every milestone every child attains, we should always remember there's gratitude to God Almighty for making them to attain it. And there should be a reward from us to them, because that will encourage them to do more than what we are just over. Because most times as parents, we look at the overboard, but I will implore us to not look at the overboard, but let's celebrate every steps that every one of us have achieved. Thank you so much, Fatty.
Yeah, thank you so much. Thank you so much for this beautiful addition. I was trying to keep up with, putting down the notes of things that you suggested, and I felt so strongly connected when you said, give eye contact to your child. Like, I really don't pay attention to those things, really. And it broke my mind. Sometimes I do, but it's not like I don't do, it's just that I don't pay attention. Just like I said, when we started this thing, some things we are doing it maybe unconsciously or consciously, but we're not paying attention to it. And this is the reason why we're here, to remind ourselves, to learn something, to put something at the back of our head to stick, and to, just to click on that reminder to tell us that, okay, so you should do this more often. I cannot overemphasize the importance of consistency. Even as an autism parent coach, I talk to parents about, how much consistency really matters in raising children with special needs, in terms of, getting to their milestones. And, and you talked about, the message, we parents, and this is also vital. Even during the Senifon conference that we had last week, I remembered an educator, talked about how we should really emphasize on, what children are. Let children be children, let children be children, let them, and enjoy what they're doing, and just give them the right message as the child, and just take them as they are. I also, the children do mirror us, and they watch our actions and utterances, gratitude and reward for a child to encourage them. In fact, this is just a really combination of good takeaways for today's session. Thank you so much, Kauthar. I have in the comment section, Khadija, thank you so much for your feedback. This is for Dr. Maryam. I'd like to say she has a super solid set of qualification, a medical doctor, which deals more with physical symptoms and with an added advantage of being a mental and behavioral expert. Many kids in the past have lost the opportunity of getting proper diagnosis because doctors had little or no knowledge of certain behavioral issues or how the environment or our behaviors can influence the development of, certain illness. This is why I call her super solid. Thank you so much, Dr. Maryam. That is for you. My head is swelling on your behalf. Thanks, Ms. Busari. My take home, remove pessimism and gratitude and reward. Thank you so much, Sister Khadija. Thank you so much for your feedback. If anyone has any question, I think we would like to round up. I'm really happy that we're able to, put everything in and finish it in an hour as we planned, even though we planned less, but there were so many takeaways from today's session. I am super happy. I'm proud that we did this. Thank you so much, Dr. Maryam. Thank you, Kauthar, for this beautiful session. I had one question that I wanted to ask Kauthar. When you talk about words of affirmations, can you give parents a little bit of, how, a little bit insight into using words of affirmation? Just give us one or two. Remember that we're talking about children with special needs and disabilities. So often at times you might have children that might not be responsive, but they can hear us. It depends on each parent and child's needs. But also, can you give us two or three main words of affirmation that we can actually use for our child? To get the best out of them.
All right, thank you so much. So for the first one, I'm going to say every child love a word called I love you.
Yes.
So tell the child, I love you. Do you know I love you? You're my baby. Even as an adult, when a child comes to you and say, Mommy, I love you, like,
yeah, yes.
So these words awaken the spirits when you tell a child, I love you. So that word goes a long way. And when you're saying I love you, it's not love just a nonchalant love.
Yes, you mean it.
Yes, you have to say genuinely, I love you, Baba. I love you, Mama. When you talk to this child, you're saying I love you, and you're like, you're falling on the child's shoulder like I love you, or you're looking straight into that child's eye. That child really connects with you. The second one I will drop is when they're having meltdown. Sometimes it's very difficult to get them back, but always tell them, I appreciate you. I know you're a good boy. When you tell them I appreciate you and you have a connection with their hands and their eyes, they want to I appreciate you. What have I done? They might not really understand the word appreciate, but just use it consistently. It's not just sometimes that it's not something you just use once and you let go.
Yeah.
But you use it consistently. Yeah. I love you. I appreciate you.
I appreciate you.
Yes, those two words goes. I've tried it. I know it goes a long way. So I will drop those two and let's work with them. There are still more.
I know.
I'm working on my affirmation cards. Don't worry. When it's out, I'm gonna let everyone know. So we could really use that.
We will look forward to seeing your affirmation cards and when they are ready. And I believe it will be very useful to a lot of parents that will need to use those positive words to reaffirm positiveness and instill positive mindset in their children from a very young age. Just like you explained in the beginning, it is very important that we build that positive ground. We build it from the beginning. A lot of us suffer from, that mindset of not having that positiveness until we had to grow and start to find that positiveness within us. And, I think it will be a very good.
Yeah,
it takes a longer time.
Yes, for us to get there.
For us to get there. So thank you so much, everyone, for being here. Thank you so much for making time. Biola is Zuberi. Thank you, Dr. Maryam, Ms. Kauthar. You're welcome, everyone. Thank you for staying through to the end of the session. I hope you enjoyed the session. I hope it is serves as a beneficial session for you, because this is really what is the most important. I hope it serves you well in your daily lives, in your mental state, in your day-to-day activities. I hope you remember us in your prayers as we go into the next year. Thank you so much, Dr. Maryam. Do you have something to say to round up, and then we can say our goodbyes?
Well, thank you, Khadija, for the wonderful message. It's uplifting. I thank you very much.
Kauthar. Yeah, okay, yes, for Khadija, yes.
Yes,
the
from
message.
Khadija, yes. And
Yes,
also thank you for your contributions. I've written some things down, and Fatty has spoken about them. And I cannot wait to see your cards, your affirmation cards. So please share with us when you are done. Thank you very much, everyone, for listening, and I'm glad we could impact on each other. Thank you.
Yes, thank you. Thank you,
Mariam.
so
much, Doctor.
Yes. So I hope we'll be seen again for another session, probably in, I know we'll definitely be doing something soon together again, inshallah. So do have a lovely evening, everyone. Good night. Bye.
Thank you. Bye.
Okay.